It is Wednesday, May the 5th, and we are in the middle of Mental Health Week, but this day is set aside for maternal mental health. And with me today is Tiffany Smith. Tiffany and I first met, I think, Tiffany, it was at Innisfil Beach Park and it was on this day, Maternal Mental Health Day, and you organized a walk through Innisfil Beach Park, and the weather was similar too. It was a bit gray and drizzly that day, but ever since then, you've been such a champion for maternal mental health. And we do have a proclamation that is on our council agenda, but I just wanted Tiffany to be with me here today to talk a little bit about the importance of maternal mental health.
Thank you so much for having me. And again, my name is Tiffany Smith. I am a mental health advocate. I am the owner of Serenity Wellness Group. So I'm a childbirth educator, birth and postpartum doula, as well as a yoga instructor. I'm also a mom of 3, and I have personally suffered with postpartum depression and anxiety myself. So this is a passion that is very, very, very close to my heart, both professionally and personally. So I will read the proclamation. Thank you so much to the town of Innisfil. They are always amazing. This is our 3rd year in proclaiming today as World Maternal Mental Health Day in Innisfil. And I'll go ahead and read that proclamation. So today, May 5th, 2021 is World Maternal Mental Health Day in Innisfil. Whereas since 2016, a multidisciplinary group of international maternal mental health activists, academics, clinicians, and people with lived experiences are coming together once a year to raise awareness to demand maternal mental health services for all. And whereas in many countries, as many as 1 in 5 new mothers experience some type of perinatal mental health, mood disorder, and anxiety. These illnesses frequently go unnoticed and untreated, often with tragic and long-term consequences to both mother and child. And whereas no one is immune, women of every culture, age, income level, and race can develop perinatal mood and anxiety disorders. Symptoms can appear anytime during pregnancy and the first 12 months after childbirth. There are effective and well-researched treatment options available to help women recover. And whereas increasing awareness will drive social change and a goal towards improving the quality of care for women experiencing all types of perinatal mood disorders and reducing the stigma of maternal mental illness, we are encouraging mental health professionals, friends, and relatives of new moms to ask her how she's really feeling and encourage her to seek help, raising awareness of maternal mental health issues so that more women will get treatment and fewer will suffer. Now, therefore, the town of Innisfil hereby proclaims May 5th, 2021 as World Maternal Mental Health Day. And I would just like to say a few things quickly while I'm here. So 1 in 5 women do experience some sort of perinatal mental health disorder. 20% of women and 10% of men suffer from perinatal mental illness in Canada, and rates during the COVID-19 global pandemic have doubled. Indigenous mothers are 20% more likely to suffer from prenatal and postpartum than white Caucasian mothers in Canada. Black, Indigenous, and people of color, people with disabilities, gender, and sexual minority populations experience much higher rates of perinatal mental illness. 3/4 of women are not identified, just 10% of those requiring mental health care receive it. Even if diagnosed, only 15% of women receive evidence-based treatment. Innisfil is an absolutely amazing community, and I encourage you to reach out for support. We do have a group that's called Innisfil Supports Maternal Mental Health Awareness. All week, I will be posting local resources. The CMHA is also an amazing local resource. Programs and policies have not kept up with best practices or research. Services currently available to those experiencing perinatal mental health disorders in Canada are largely inadequate. And this is a public health crisis, not only for maternal mental health, but mental health in general. So I encourage you to speak out, talk to loved ones, reach out to new moms, reach out to postpartum moms, listen to them, let them know that you're there, and reach out to our community. There's also a Facebook group called Innisfil's Mom Clubs. They are an amazing group of like-minded moms. Connect with them. I encourage you to join that group, as well as our Innisfil Supports Maternal Mental Health group. Reach out into our community. There are lots of services and support available. Thank you so much for having me.
Thank you so much, Tiffany, for your advocacy on this very, very important initiative. And I also would like to thank the Innisfil Community Foundation for making a significant donation to Canadian Mental Health Association this week. Certainly the pandemic has, through our needs assessment, has made it very clear to us that this is something we do need to step up. So yes, reach out to those prenatal moms that you might know. Make sure that you get real about how you feel and take care of each other. Thank you, Innisfil.